Hi, this is Nettie. I'm going to take you through the onboarding procedures and basic information for genetic cancer screening. This video is designed to take you through the cancer screening section of the sales portal. Once you've entered the sales portal, let me just bring it up really quickly. Once you've entered the sales portal, just go to the link labeled Genetic Cancer Screening, found here. From there, you'll see at the top you have doctor registration and onboarding. The first form here is the registration form, and is where you're going to enter all of the doctor's account information. If you already have the doctor's account information from other services he participates in, then you're just going to fill this out yourself and fax it back to us. So basically we need the institution information, practice information. If there's an NPI number associated with the practice, then we'll need that. We need the ordering provider, his title and NPI number, mailing address, phone number, fax number, email address, and any additional physician or genetic counselor who's going to be copied on the results will need that as well. Okay, make sure you put your name and your email so that we know that you're associated with this account. And the next document is where the doctor indicates the supplies that she requires. So basically you're going to tell who we're going to ship to, the address, if they require all new testing supplies and shipping labels as follows, quantity. If they have a supply of testing kits and only require certain supplies, then just indicate them right there. Okay. The documents in this section of the portal help the physician to determine who can be covered by insurance. However, if the patient is a cash pay patient, then they can order any test that they want. The patient questionnaire, let me bring the portal up again. The patient questionnaire is used to determine medical necessity here. It's a screening tool to help determine which commercial insurance patients would be covered. So the doctor is going to use this as a reference to fill out the physician's checklist, which we're going to go over in just a moment. But here you'll see they want to indicate if it's a first-degree relative or themselves and under which cancer. So for instance, if it's the patient themselves who have had colorectal cancer, they'll put this right here, okay, and their age. If it's a second or third degree relative on their mother's side who has colorectal cancer, they'll indicate who it is. Their aunt and their grandfather both had it at ages 56 and 45, and so on. So the same for the father's side. Okay, the Medicare personal history document is to determine if the Medicare patient requires testing. So this is how they'll determine for Medicare patients. And then here you see the physician checklist, which is what I was talking about before. They're going to use the first, let me bring it up again. They're going to use the patient questionnaire that we just went over, which is filled out by the patient, in order to fill out their own checklist, which they're going to send along with the requisition form. So they fill this out according to the patient questionnaire and submit it so that the insurance companies know that it is medically necessary. All right. And then the documents in this section of the portal are for your general information and to help you inform the doctor. So let me bring up the portal once again. The first entry here outlines the comparison between our lab and our competitors, and how your potential client's practice will benefit from working with us over our competitors. So you can see that we offer multiple technologies, broader test availability, customized tests. We can perform any number of combined panels to accommodate any patient. We do research and development, offer support to both the patient and physician, and can offer a breast cancer prognosis. and possible referring doctor. This is a tool for you to be able to see who's going to be able to refer and who can order which tests. All right, the hereditary cancer workflow sheet. This details the workflow for the physician, basically. Okay. The hereditary requisition form. This is what the doctor will receive with the supplies to send with the samples. So this is how to send the results, or the samples rather. You send it with the requisition form that the physician does. Okay, and the physician will be able to access results via an online provider portal. And when the first result is available, their accounts department will receive an email with login credentials to the provider's portal. The login credentials will be sent to the primary office contact, email identified on the enrollment form. And back to the portal. The ICD-10 codes to keep in your binder, just to show the doctors if they want to see. This is how they code for reimbursement. So let me just open this up. And so you'll see it's divided here into the different types. So there's bladder and renal, breast and ovarian, endocrine, gastric, and then they can see which codes they're going to use, and it has a little description here. This is an example of the report that they'll get. Here you see the doctor gets a clear result, an interpretation summary, a recommendation based on the result, and comments on individual variants. Here we also have a methodology for each result. These results can come either via HIPAA-compliant portal or fax. Here I have a list of the frequently asked questions. Let me zoom it in a bit. So you can go through this at your convenience. It just indicates the most frequently asked questions here. Here we have the genes list and related risk. This document you can give to the doctor, or you can use for your own information if you feel like reading up on the genes. But this is mainly a document that you can give for your physician. The Onoscan and prostate prognosis. This is just a little FYI, so that you can read a little bit about this. All right, and now on to billing. Let me reopen the portal. The cash pay patients, this basically just outlines the price for cash pay patients. If they want a 94 gene panel, the cash price is $4,995. 52 genes is $3,995. For an HPV test, $60, and so on. And the explanation of financial assistance. Here you can see that households earning $50,000 a year or less are only responsible for $40. $50,000 up to $75,000, $100, and so on. You can see here. And then they have 6 months to pay, and so on. So you can go through that on your own. You can leave that for your physician. And then this describes the financial assistance program. This is for the for the, I believe this is for the patient to fill out. Yep, this one's for the patient to fill out. So they'll fill this out. And then we also need for the physician to fill one out as well. So this needs to be sent, if it's not sent with the kit, then it'll need to be received separately no later than 72 hours after the test requisition. And then just to review, this is what our cancer lab screens for. Breast and ovarian cancer, we have colorectal cancer, familial melanoma, Li-Fraumeni syndrome, anoscan and prostate cancer, endocrine system, familial gastric cancer, familial pancreatic cancer, bladder and kidney cancer, and then we can do a comprehensive 94 gene panel. And then exome. The exome, the protein coding region of the human genome, represents less than 2% of the genetic code, but contains 85% of known disease-related variants, making whole exome sequencing a cost-effective alternative to whole genome sequencing. So that's basically an option as well. And then if you have any questions following the conclusion of this video, just send them via email to my email address right here. I'll be adding a few more documents to the FYI section of the portal, and we'll include a new video if I feel like it's needed. But basically it's just for you to understand